of the day. As Senior Policy Director for Easterseals, Connie Garner focuses her practice on policy development, implementation, and advocacy strategy related to vulnerable populations. In addition, she continues to serve as the Executive Director of Allies for Independence, a nonprofit coalition dedicated to addressing long-term service and support needs in the disability and aging community. Her areas of expertise include healthcare, disability, mental health, substance use disorders, long-term care, and education policy. Connie's current consulting work involves advising state programs, health insurers, provider groups, all on the needed services and supports as they begin to include populations in Medicaid managed care. And she also, another primary area of consultation involves the implementation of mental health parity and working with health insurers in the development of alternative payment methods. So today, our first keynote, Connie joins us to talk about why consumer provider partnerships matter into the future beyond the pandemic. Connie, welcome. We're so glad you're with us.
Thank you. Thank you for having me. Thank you for having me. Okay. And we are going to talk a little bit today about a variety of things. A little bit of a look back on the last 2 years to start with. Can I get that first slide up? Thank you. Now, this is an important slide, at least to me, because this represents in my mind, and you can make it bigger or however you want to do it, but this represents in my mind what we're all trying to achieve. And we're really trying to achieve a system where people are comfortable with each other, people have the things that they need, and people are able to grow like a community. So this is what I think the ultimate goal of a consumer and provider partnership needs to work towards, is this type of a scenario. This is what we're trying to really look for. And so that's why I like this one. This builds capacity. It speaks to the issue of building capacity, both with the consumers and the provider networks that are out there. And we want consumers and providers to work closer together and to respect each other's viewpoints and side of the story. That becomes sometimes an issue in what we're doing. I fortunately was able to work up in the Senate for almost 20 years, 19 years, for Senator Ted Kennedy. And he believed strongly in the potential of people to partner. I mean, he believed that. He believed that in the work that he did and all the work that we did. If we ever had an idea for a new piece of legislation and you would go and talk to him about it, the first thing he would say is, how are you going to pay for it? And who's my partner in it? Always looking for representation from the Republican side. And so that's how we did our work for 19 years, answering that question every time a new idea came up. But it had to do with the commitment of everybody to whatever the outcome was we were trying to do. I think we need to work on that in this day and age a little bit more than what we're doing. So that's pretty much what I wanted to kind of say about that. But that relationship between the provider and the consumer is so very important. We talk a lot about direct care providers. They do an awful lot in home and community-based services to try to make sure that people get what they need and that they're brought to equal, and can participate in their community. There's no question they do that. But one of the things that's happened over the years, which is, I think, a little bit disturbing, and we need to fix this, is there seems to be this divide in terms of the disability community and the advocacy groups. Are you a advocacy group? Are you a civil rights group? Are you a provider group? If you're a provider group, then you're not about the real people. And that's really not true. And I don't know why that's happened over the years, but it has. And we need to correct that. We need to bridge that gap. Okay, there isn't a provider of services out there that doesn't care a lot about the individuals that they're serving. And they care about the issues that are important to them as well. So this divide of am I a provider group or am I an advocacy group needs to stop. And we really need to be looking at things from a more global way. And this really hits home with me because I actually am a pediatric and a neonatal nurse practitioner by trade. And I've continued to do that through the years. Even when I worked in the Senate, I got special dispensation to be able to still work. And it really becomes important. And during this last year, I guess it's been a little over a year of the COVID, I actually worked every other Saturday in the hospital. And they put me with the adults, not with the kids, because that wasn't where the need was at the time. So I was working in adult intensive care. And one of the things that became so clear to me was it was a different kind of an issue in the ICU. We all knew what was needed to deal with the physical piece of this. We knew that it was going to be respiratory, it was going to be global, and it was going to be, full system if people got really, really sick. But the big problem, the big thing, at least that we saw in our hospital, was the loneliness and the isolation and the issues related to that. And if you even take that out of the hospital, you see that with some of what these last 2 years have left us with. Certainly, isolation for the elderly has become a big issue, and then isolation for the young children, even the young kids in school, in special ed, has become an issue. But one of the things that I really began to appreciate and talked a lot about when I worked was the fact that the people that made the real difference. I mean, we did what we needed to do. We dealt with the acute illness and injury stage of these folks. But what really mattered the most was the individuals who helped those patients when they left the hospital, when they went home, to be the very best they could be. And that's the direct service professionals. And so we need to work hard to do two things, I think. One is to get them the resources they need to do the job, to get them the benefits they need to make it worth it for them. But then second to that, we need to really lift that profession so that individuals see that that's an important profession, and it is a profession, and it takes professional viewpoints to be able to do it the right way. I've often said to people, we just do what you do in a hospital. Right. But the people that make the biggest difference in your life are going to be those who do spend the time bringing you back to equal to where you were so that you can function effectively in your home, in your work, in your community. So that's my plug for direct service providers. And I have a really kind of a renewed appreciation for the work that they do, having seen them in action the last 2 years. So that was an important perspective for me. I've had an interesting experience working in the hospital for the number of years I have. My very first piece when I was in the hospital was to deal with the Air Florida crash. And that was my first responsibility when I graduated, was to take care of some of what was going to happen with that, which again was not the individual person, because many of them did not survive and only a few did. But the implications of what it meant to the family and to the system was really, quite dramatic. And there's a role for all of us in that. And I think that's the thing that we need to think about, is how do we collaborate? How do we get a real good commitment to provider and consumer working relationships so that it works well? So some of the things now, though, that you see when you look at the last few years and where we are going now, is a very different looking marketplace for home and community-based services, I think. If you look at that, there are industries now in the private sector that are looking really hard to be able to provide home and community-based services. And so the question is, have we as nonprofit groups, have we kept up with that competition? Do we compete with them? Do we join forces with them? How do we think about that? I'm going to argue that as much as you want to compete, that I think it's important to figure out whether, and there may not be, but whether there is a way to work collaboratively as a partner with them. But they're out there, and they're becoming more and more prevalent. But why is the marketplace looking different with home and community-based services? I think because there's much more options there that weren't there before. We see a lot of a commitment to digital therapeutics, for example. For the autism community, and particularly for the kids, there is a number of digital therapeutics that are now out there for them to use and to benefit from in terms of their functionality. Self-directed care and self-directed models is really new, not new, but you've been doing it in California much more than at least the East Coast where I'm from. But that's an interesting model, because you would say, well, what do people get from that they don't get from a regular service delivery system like we do? Well, they get choice, and that is a piece that we're missing a lot, is choice, whether it's school or whether it's elder care or whether it's everybody in the middle. Choice is a big deal, and self-directed care allows you to have that choice if it's done in the most, in the way that it was intended to be. So self-directed care becomes important, but that's a piece that you could certainly integrate into the current model that we have, the delivery model. If we just took the time to talk to the patient and really ask the individual and the family, what is their priorities really? What do they want? And I don't mean a check the box type list like we have on a lot of these flow sheets, but I'm talking about a serious conversation where they really do begin to construct it. And if we don't have what they need, then we should be able to go and find it. So self-directed care is another place to invest some time, because you can work collaboratively with these new groups that are out there, or you can develop your own model that you do with your care delivery a little bit more. So that's the self-directed piece. And then you'll see there'll be a lot of new educational modalities that are coming up for schools. The real question now in the education community about, what are we doing with education? Should it look different? And I don't mean, they're not thinking about it necessarily in terms of virtual versus not virtual. They're thinking it in terms of what they're teaching, how they're teaching, whether what they're teaching makes sense for young people growing up today. So where are children with disabilities in that? Are they still back in the traditional IDEA model that doesn't really change because everybody's afraid to change it? Is that where they are? No. I mean, the kids aren't, but maybe the system is. So those are the pieces that I think we need to think about. As nonprofit providers working with families, we have the ability to really be very personalized care. And personalized care is a big ticket item right now. And so what's the first thing that we would ask a provider to do? It's to ask the consumer, ask the person, what is it that they're interested in? What is it that they want? How do they see their role? How do they see your role? Really get underneath that, rather than what sometimes you see happening, which is the checklist, and see if you can get beyond that, because I think that's what will keep our business model going. And it's also the right thing to do, I would argue. And then from a consumer point of view, are you putting your input where it needs to be? Are you getting involved in the politics of California? Are you getting involved in the politics of the national conversation? I am very fascinated to watch what's happening with the HCBS movement, because it started out really, really big, and you saw that the individuals from the disability community worked really hard. The provider groups worked really hard to be able to move it along, and now it's not there. It's there, but it's not there. We need to do a lot more work on this. We need to have some campaigns. We need to make it real. We need to make it real to real people, because part of what I think our issue is, and I worked on long-term care for a long time, but part of what I think our issue is that nobody really wants to identify with this and own it, because it's scary. It's scary. And so they don't want to own it and take it on. We need to do that. We know what this is about. We know what people need to be the best that they can be. And we need to have the government listen to that and understand that. And understand that this is not a special interest group. This is about every one of us who don't know who we're going to be 24 hours from now. And I remember having this conversation right before the Boston Marathon problem that went on up in Boston, and talking about how no one got up that day and thought they were going to get blown up by 5 o'clock. I mean, that's not, so we don't know who we're going to be in the next 24 hours yet. We don't spend very much time in this country investing in that. We don't have a safety net for all people in that. We have a safety net with Medicaid, which is important, but Medicaid has criteria. Medicaid has criteria that you have to meet in order to be eligible for it. So you need to be essentially, pretty much you need to be poor and significant in a lot of cases to even get that service. so I mean, we need to think about, what do you do for that person who's just above minimum wage? What do you do for that person that's a middle income person who has 2 or 3 children? They have to take care of them. They have to care about other stuff. They have to care about there's the children and their education and their future and all of that. They can't afford, because of those issues, to necessarily get income restricted. But yet that's our criteria, right? We raise the minimum wage, and then if people, particularly people with disabilities, are working, they can't make as much as the minimum wages sometimes, or else it blows their Medicaid eligibility. So there's a lot of internal inconsistency, I'm going to argue, in the policies that we have right now. So that gives us a lot of issues to continue to work on now as things.
Connie, are you there? We're not hearing you. Hold on one moment. Connie, are you muted? Okay. So, Connie, it looks like you are muted. Can you hear me, Tulip? Okay. At the very bottom, Connie, do you see a button that says mute at the mute next to stop camera?
There, how's that? Is that better?
Well, yep. Thank you.
Now, I don't know how that happened. I just want to say, I don't know. And the dog isn't around here and the kids aren't around here. So I'm not sure how that just happened. But anyway, getting back to what we were talking about. So those are the kinds of things we don't want to be left out and left behind. And I know we use that word, that little acronym, a lot, but we don't want to be left out and left behind. So we want to make sure that we're watching what's going to change, and that people with disabilities and our disability programs are included. And I think the education piece is very important with IDEA. IDEA, well, I did the last reauthorization of it, so that's how old it is. But IDEA, eventually has to get reauthorized. I know people are scared to do that, but it needs to be brought into the 21st century. What are we doing with transition? Where are we putting the accountability on the school system and the other agencies to work together long before that young person leaves the bricks and mortar, to be able to get that transition moving correctly? We know that for children with developmental disabilities, that are young people with developmental disabilities that are beginning to transition, that is the hardest mental health transition that there is for them. We know that. We have data on that. So how are we addressing that proactively? I mean, what are we doing? Those kids have a high rate of suicide. They have a high rate of mental illness as a result of this anxiety that goes along with transition, for all children, for all people, but for them in particular. This transition from school to the rest of your life is really quite difficult for them. So, we need to be at the table asking those questions. What are we doing? How are they included in some preventative mental health and ongoing mental health support to get through transition? And how are we making transition more effective, so that these young people have jobs when they leave, and they are able to stay with them? Sometimes the staying with a job, or staying employed, doesn't have to be the same job, becomes a biggest challenge as well. So those are some issues that we need to work on. With home and community-based services, I would hope that you'll all be part of a giant campaign, and there's a number of them going on right now, to be able to get that across the finish line. That's the hardest part. We can have good ideas, but it's like that ball that gets caught in the outfield. Once it gets caught, it's over. And so, we need to work on that. We need to work hard on that too, because I think that's an important piece for us to look at. And then the digital therapeutics, that's really kind of an interesting area. And you live in the area where that's going to grow, and probably the ideas will come from California half the time. So where are we from a disability perspective on that? Have things been, are we accommodated within digital therapeutics? I mean, or is this going to be another fight around accommodations? So that's another area that so there are a lot of places I could identify, at least, where I think we need to be working from a disability perspective to be included, so that people with disabilities get access to the new information, and they're able to be the best that they can be. And I think that's what this is all about. That's what your conference is all about. And yeah, the last 2 years and COVID have been difficult, but it's time to move on. It's time to stop spinning wheels and move on. I think everybody did a great job during COVID, and it's very taxing. I can tell you, just even from my nurse experience, you're just so tired at the end of a shift when you're working with these folks. And it's not so much the stress of the people; it's more the taxingness, if you will, that you get from the psychological part of this, because that's what really is very, very hard. The isolation, watching people suffer through that, it's just hard. But anyway, hopefully that's pretty much behind us, and we're going to move forward. And those are the kinds of things that I felt like it were important to talk with you about today. And I'm interested to see what you think, and where you think providers and consumers can come together better to be able to provide for people with disabilities and the aging population, people who have functional limitations. I mean, that's what this is about. It's really about working with the functional limitations and trying to bring people back to equal, or as close as they can get to equal, so that they're able to function. And that's really what a lot of this is about. So I'm interested to take your Q&A now and see what you all are thinking about these issues.
Thank you, Connie, for challenging us and making us think in so many different ways right now. And
Thank you, Connie.
Yeah. Elizabeth, I don't know if there was anything that you wanted to ask Connie to start with. If not, I don't know if we have any questions out there in the chat from the audience. A reminder, you can always put your question in the chat, in the stage right there.
I just would like to piggyback on what Connie was saying, that we have to bridge the gap between providers and people that we serve. We all need to be on the same playing field, if you will. It's not us against them or them against us. It's how we come together to be a stronger community. Because it might be the provider's time next. If you live long enough, you get old and you have a disability. So these services can help you also.
That's right. Yep.
Great comment, Elizabeth. Thanks, Connie. I know we have a couple questions, it looks like, from the audience. How do we best partner with advocates to our funders to have the flexibility to provide more person-centered supports?
Okay, well, let's think about that. And if
Partner
other,
with Advocate too, our funders.
yeah. All right, well, let's think about that. So how do you advocate with your funders to have more flexibility to provide person-centered care? Well, first of all, I think that you can explain what person-centered supports are, because a number of them may not even know what that is, and why using them as an example, it matters, and why it matters to them, and why if it were them, that's what they would want to see happen. So I think you have to make real what person-centered care supports is all about, because I don't think a lot of people really understand it. They hear the 50-cent buzzword, but I'm not sure they really understand what that means and what it looks like and what a person-centered plan would look like for you or them or whoever. So I think that's the first place to start with that. And then I think you can take it from there, and you can take it down a number of ways. I mean, you could take it down the economics argument, you could take it, but that's not, I think what really sells is when you make things real to real people, and they're real people underneath all of their funder hats, and somehow you got to get under that. You got to get under that hood, and I think you can do that. I think you all are very good at that. So I think you can do that and making it real. So that would be where I would start.
Thanks, Connie. I think we have a couple more. Can you share examples of consumers becoming providers or creating innovative programs?
Examples of consumers becoming providers and doing innovative programs. Yeah, I mean, you do have people who have been consumers, and then they develop something new. A lot of it's been on the computer and the internet and stuff like that. They develop that, and then there are innovative programs that they develop. Particularly, I think when we were working on long-term care originally, long before this conversation, when we were working on it, we had a person with a disability who, in their basement, really created some great pieces of advocacy to help us, and was able to figure out on the internet long before everybody else was how to get them out there and how to make people be able to see it. So that's how I think they took their creativity and really used it to the maximum capacity. So I think that's one way to do it. That's one example that I would have of that. Does anyone else have another example of a consumer turned into a provider and it worked out well?
We can see if anybody puts any in the chat. Yeah.
Mm-hmm.
And do we have one more question, I believe? Connie, do you think future medical programs will include more or better training regarding neurodiversities? Will future doctors ever have to observe or work with people with autism spectrum disorder? And will they work with people with significant or severe autism spectrum disorder, or perhaps aggressive volatile behaviors?
Yeah, I think that's a great question, because that's a real lack of capability within the medical system, as you know. I mean, it's, some people will say, oh, it's in dentistry. It's in dentistry. It's in the whole community of the medical practice. And it's really hard to find a doctor especially when you're transitioning a young person from a pediatrician forward. I mean, even the pediatricians could use this, because they're dealing with a lot of the early parts of autism and early parts of neurodevelopmental issues. So I do think that demand, the problem is this: the demand for it needs to be there. We have to raise the level of awareness that that's not there, raise the level of awareness how important it is as patients, consumers, whatever buzzword we're going to use for that. And then we can argue, then you'll begin to see people coming to the school system, to come into the medical school system and asking that question: does your curriculum include, X, Y, and Z? And if they can answer it, fine. But I mean, we have a role to play in increasing that level of awareness. I think it'd be very interesting to have a program like you have here today and yesterday, and include a panel of doctors, nurses, and Indian chiefs, and have them talk about this. And how comfortable are you? What do you need? What does the system need to be able to do things differently? I mean, we have a hard enough time sometimes with food insecurity. getting people like pediatricians to talk about food insecurity and, you know, referring people to where they can get the food bank stuff. So I mean, that's in comparison, you would think that would be an easier thing to deal with, but this issue that we're talking about with the neurodevelopmental is a real issue. And in the hospitals, it's really an interesting issue too, because the staff that work in the hospitals are nervous if they haven't had experience with it, somebody in their family, they are very nervous when they have a patient that has those needs and whether they're doing the right thing or what the right thing even is for the family and those patients. So I think it's a great question. And I think that's another place we could work. And we could do that with some of the legislation that's out there that does provide dollars for medical education programs and see where within that is there a nexus with this issue that we could try to push. So good question.
Connie, thank you so much for all the incredibly meaningful work you are doing to move the needle forward, improving services and supports for people with intellectual and developmental disabilities. It's been a real pleasure having you kick off our day 2 to really get our brain thinking about all the possibilities and places we should be focusing for the future. Thank you for joining us.
Thank you for having me. I appreciate it. I hope you have a great
Thank
rest
you
of the
so much.
That was Connie Garner from Easterseals.